My name is Sara Karsten. I am 58 years old. I've been married for 30 years. I have 2 children. I drive a school bus. Love it. Love my kids, love my job. I was having some issues. I made an appointment with my physician and saw him.
After we talked, we felt it was important to do further workup and send her on to a gastroenterologist to do a little bit more in-depth evaluation.
When I did her colonoscopy, it was normal except that she had a very small nodule right just inside the rectum that we biopsied, and that came back as being cancer.
After they had all the results back from that, I was contacted by a nurse navigator.
With Sara, as with most patients, they get a diagnosis, and that's often a scary time. They're often not hearing very well because they hear just the cancer word. So you have to, reiterate quite often, I'm here to help you. She had to see a surgeon, and she had to see a medical oncologist and a radiation oncologist. I had her see a social worker. All those disciplinaries had to make the appointments to get her to be seen and explain why she needs all that. So a lot of it's education, and a lot of it is just being there for them.
They really took care of everything. They called me, set the appointments, told me exactly what I had to do, where I needed to be when, the blood work, CT scans, MRIs, and then once they had all the results from that, then I met with the team.
The first thing that struck me when I saw her was her smile. She has a great smile and brings in a lot of positivity. And this was even at the stage when she was just recently diagnosed of this disease. And she's kept her smile throughout the whole endeavor.
The referral process from the time I saw Dr. Harrow, then being referred to Dr. Lown to see what was going on, and then from the cancer diagnosis being referred to LAX Cancer Center, and then having my team put in place at that time, really seamless.
Very important part of the medical community here is how closely it works together. So the fact that she saw her primary care physician with some fairly minor symptoms with some blood in the stool that then prompted a very quick referral to our office, where we were then able to schedule her for a colonoscopy quite quickly. And then again, referring her to the LAX Cancer Center is another very quick referral within the system. They generally see patients within just a few days to initiate therapy and treatment. So the whole process is very integrated and usually occurs very rapidly.
Mercy Health Physician Partners really is intended to help create a system that can manage all of the patient's needs.
And that process is all helped by the fact that we use similar computer systems. It's easy for them to pull up my colonoscopy report. It's easy for me to pull up their reports.
That is a seamless system that we have here within Mercy Health, where we have access to all necessary documentation within one system and good communication between physicians.
All of those things work very seamlessly. That obviously helps in terms of patient care and patient outcomes.
Well, my experience was great. I just felt like everybody was kind of on the same page. I always felt like if I had a question or a need, I could contact them. It was seamless. It really, for me, worked really well.
Sara's a great example of a patient that has a great outcome. She currently is cancer-free and living her life as well as she can.
I don't sweat the small stuff as much as I used to. I mean, things kind of have a different context, if you would, in my life. But no, life is good. Life is good.